Namaskar and welcome to Apollo 24/7's Health Hour. This is a show where we bring you a lot of information right with the expert. Your questions will be answered. Our Apollo experts are here to answer your queries that have been lingering in your mind for a while. Sometimes you do not want to consult a physician if you don't have a problem, but you want some information. This is the right platform where you can contact us and get your doubts resolved. So here on the show, we bring you an expert from Apollo Hospitals, and today we're going to talk about our digestive system, how to keep our digestive system healthy. And on the show, we are going to have a health quiz as well, and going to give some health coupons as well. Stay put with us. Towards the end, we're going to have a health quiz. And how do we keep this digestive system healthy is the question, and a big question in the world, in the era of junk food and all those spicy, interesting foods around us. So here we have an expert who's going to tell you how to keep your digestive tract healthy. Dr. Ankit Vijay Agarwal, with 14 plus years of experience, who's a gastroenterologist, hepatologist and therapeutic endoscopist from Apollo Hospitals, Jubilee Hills, Hyderabad. Dr. Ankit specializes in the treatment of all issues related to liver, pancreas, that include acid peptic disease, gastric and duodenal ulcer, GERD, IBS, other functional disorders, IBD, hepatitis, cirrhosis of the liver, liver cancer, acute and chronic pancreatitis, fissures and hemorrhoids as well. Diagnostic and therapeutic endoscopy, which includes ERCP, EUS and manometry as well. So it's a pleasure and honor welcoming Dr. Ankit Agarwal ji onto the show. Good morning, Doctor. Namaskar.
Namaskar, good morning. It's a pleasure to be on this channel to interact with you, ma'am, and with our participants here. I'm sure we'll have a good session.
Absolutely. The moment we say it is about digestive system, I know our audience require help. It is not just a question, yes, but it is actually seeking help. So, doctor, you must be, these must be the regular things that you see in the clinic. I'm waiting for the audience to join. But जैसे कहा जाता है, you are what you eat. So, can we establish?
I think that holds.
Yeah.
True. Okay, we are what we eat, and given the current society, like you started off the topic, that in the current era with a restaurant opening every other day, and people eating out, and so much access to food with online food delivery platforms, people consuming junk food and people eating overeating has gone up significantly, and then this has led to quite a lot of people coming to us with digestive issues. And it's not only the elderly that you would think who are having digestive issues, even the young, even children and the middle-aged or the young population who should not be having these issues are coming to us with serious digestive issues. And that all boils down to what we are eating and the high amount of processed food that we have been consuming of late. Along with this, the higher stress that we're going through, people are, it's a fast-paced life, everything happens at the click of a button now. So because of so much of stress that is there, people are experiencing a lot of GI-related symptoms, which is causing them a lot of morbidity and, frequent visits to the hospital and taking a lot of medications.
Right. So, Dr. Ankit, while we started off on a very good topic, diet and how to keep our diet and track to have a healthy digestive system, I see that audience are joining us slowly. There's a small request to all the audience who are joining us. We request you to give your name, age, gender, and any other issues around, and your all the questions in one possible window, so that your question is not broken into pieces. It will be easy for me to find your question and get an answer from Dr. Ankit. So what happens in our gut, doctor? So what is our digestive system? जब हम लोग खाते हैं and जब तक वो बाहर निकलता है, क्या होता है and कितना time होता है, कितने processes होते हैं?
See, it is a very complex process. It is not khaya and it just comes out. Okay, the digestive system, per se, it includes the organs right from our mouth through the anal canal. Now, this includes the mouth, the food pipe or the esophagus, the stomach, the small intestines, and the large intestine. Along with this, we have organs that help us in our digestion, which includes the liver, the pancreas, the bile ducts, the gallbladder, and the bile ducts. This all constitutes the digestive tract. So, in the digestive tract, the main roles include ingestion of food, the process of digestion starts right away through our mouth. When we consume the food, the chewing starts, and we're starting the breaking down the food, and with the help of salivary digestive enzymes, the food starts getting digested right through our mouth only. And as the food gets, passes down through the food pipe into the stomach, the next level of digestion starts, wherein the gastric acid breaks down the food into simpler molecules, and it starts churning the food. Now with this, the food moves down to the small intestine, where chemical digestion occurs with the pancreatic and the biliary juices, which break down the food into simpler molecules that can be absorbed in the small intestine. And then the food is in the large intestine, wherein water absorption occurs. The the there is elimination of food finally in the form of fecal matter. So this is the role of the digestive system. Another most important role of the digestive system is that has a major role in our immunity. We eat a variety of food every day, and the digestive tract has to realize that what is good for us, wherein it acts as a tolerance, and what is not good or what is pathogenic, and where it has to develop an immune response. The digestive tract is the largest source of immune cells in our body, and that is something a lot of people don't know about.
Right. Right. So, Doctor, why you're saying that it's just the food which moves down and then passes through, and there are processes. But what are the other causes and reasons that we knowingly or unknowingly add to this process of just a sleep hua, exercise hua? What are these factors which can cause disturbances in our digestive system?
Almost everything that we do contributes to our digestive process. Okay, you've taken the example of sleep. Having adequate sleep and rest is important, because that's how a lot of our hormonal effects, our hormonal systems are maintained. Okay, exercise improves the digestive system by improving the motility, and so also it improves our digestive process. Other factors include controlling our stress. Okay, there is a direct interaction between the brain and the intestine, known as the brain gut axis. So this brain gut axis is very important, because there is the modulation is there, and because whenever we are stressed, I believe a lot of people do experience that, when their stress factors are higher, when they're nervous about something, they tend to have frequent bowel movements, or they tend to express symptoms of acidity more, and this is because of the gut brain interaction that is there. And so also, patients who have frequent gut symptoms, they tend to be stressed, they tend to be depressed, they tend to have a lot of anxiety related issues. So it's a two-way street, and very important, yes, that stress plays a major role in our gastrointestinal symptoms.
Wow, that is so interesting to observe. We think that it's only one way, but there is an established reason that you can be disturbed with your unhealthy gut as well. So
Yes.
let me, as I'm seeing that the chat box, our audience have warmed up. Thank you, all of you. John, Rage, everybody, Vamsi, Ram Divakar ji, Debashis Bhattacharya, all of you, please, thank you so much for joining us. I'm going to ask a few of your questions today. So requesting all of you to kindly keep your questions with all the possible details in one message itself. Do not break your questions and do not repeat your questions. I'm seeing all your questions. I promise you that I'm going to take your questions up. So let me quickly ask you, there's a person here, Vamsi Nalamili. Vamsi is 24-year-old male, continuous burping even when not consuming food, or even continuous burping even in the morning. Gone appendicitis हुआ है 2 साल पहले, is continuous burping because of that. Please guide.
See, a burp or a belch occurs when we are releasing food from the stomach, like say air or gas is released out from the stomach and it comes out through the mouth. Okay, a burp or a belching has no relationship to a past appendix surgery. Okay, it generally happens when there is a extensive gas buildup in the stomach. What happens generally is that, whenever all of us would have had a burp, whenever we've had a heavy meal, that's when we usually have a burp. Okay, so whenever we are eating food, we tend to ingest a small amount of air along with it, also the air in our mouth, the air in the digestive tract. Whenever we're eating each with each bite, we tend to swallow some amount of air. Now this air goes inside the stomach, and in the stomach, that the where the food pipe, the esophagus and the stomach joins, that part is known as the lower esophageal sphincter. Now, this lower esophageal sphincter relaxes once every few minutes, and when it relaxes, the air that is there in the stomach can come out. That's known as a burp. Okay. Frequent burpings can be seen when people who are eating too quickly, people who are eating heavy meals, people who drink water too quickly. Because when you're eating quickly without chewing food, you tend to swallow a lot of air also. This is also noticed in people who consume a lot of carbonated beverages also. So, and people who chew tobacco, chewing gums, because whenever you're chewing, you tend to ingest some air, and that comes out as burpings. So, burping is something which is related to all of these. And when for somebody who has frequent eating burpings, we tell them to have small meals, chew thoroughly, eat slowly, drink water slowly. Okay, so this and do some breathing exercises. With this, the frequency of burpings and the discomfort comes down drastically.
And also be mindful of what kind of food are we eating. Is that helpful, doctor? Because too much of
Definitely.
spices or irritating food to the gut, will that also
Definitely,
help?
definitely. If you're eating food which has a lot of gas-producing properties, maybe people like milk or fatty foods, or ingesting the quantity of food also. All of these make more gas production, and people tend to burp more often when they consume these sort of foods.
Right. So here are two questions, Joby John and Uma. John hasn't given me the age, thinking that he should be a male. Uma is 41-year-old female. How do I maintain the gut or make the gut strong? That's her question. And John asks, how does one clear his gut? So clearing his gut, I am assuming he's talking about a bowel movement. And
Yes.
gut strong. What is it? The Telugu, I'm assuming that you understand Telugu. We have a
Yes, I do
saying in
understand.
Telugu, yeah, రాళ్ళు కూడా అరగొట్టుకునేంత శక్తి జీర్ణశక్తికి ఉందని. వాడు రాళ్ళు కూడా అరగొట్టుకుంటాడు రా. And you have such a strong digestive fire that he can digest stones as well. Seriously, is there something called a strong gut?
See, a strong gut, our gut has a lot of capacity. I'm not saying we can digest stones, but to make a gut strong, important is to have a healthy routine. Important is to have a diet which is balanced, having a good amount of protein, carbohydrates, and fats, not excess of any one thing. Okay, drinking adequate water is very important. Having a high fiber diet is something which a lot of people tend to neglect or ignore. Okay, along with that, making sure that you avoid foods that you're not tolerating. This is also very
Right.
important. Some people tend to
Very.
like they have symptoms when they consume specific foods, like very oily food or spicy food, or when they consume milk. So tend to, if some food you're not able to tolerate, just tend to avoid it for some time. Okay, important is to have some probiotic in your food also, like the simplest probiotic and the best probiotic that I think we have is GERD, and generally
Correct.
in South India it's something that it's available and people consume it regularly. Okay, so for a strong gut, important is to, apart from the diet, also make sure that other factors, reducing stress levels. We talked about stress, having adequate sleep. Okay, water intake is something that is very important, and physical activity, including some form of physical activity in the diet, definitely helps. And if you want to talk about the question by John about how to clear your gut, okay, so like I also presume that he's talking about having a regular and a healthy bowel movement. Okay, so for a healthy bowel movement, it is very important that we consume a diet which is rich in fiber. Okay, along with that, adequate water intake is important. Water is something that a lot of people ignore, and now that summer is starting, making sure that we consume at least 2 to 3 liters of water is very important. For those people who are exposed to heat, maybe they need to consume more water. But if you're working in an air conditioned environment, and that's when people tend to ignore their water intake, and hence good amount of water is very important. Along with
Yes.
water, a high fiber diet and regular physical activity is very
Wonderful.
important, that will help you to clear your bowel on a regular basis.
Wonderful. So, doctor, while we talk about fiber, Indian diet actually was supposed to be a good balanced meal. We
Yes.
have moved on to these processed and super processed foods, the refined foods
Yes.
that are available over the counter. Our breakfast patterns have changed. And what are the forms of fiber that you would want to stress on?
With the westernization of diet, people have started consuming processed food. Okay, we tend to see that people now prefer to eat Maggies and pastas and breads rather than that. The whole foods. Having whole food is very important. Whole grains, soluble and insoluble fiber, both are available in our things. So whenever like we talk about fiber, it is important to have both soluble and insoluble fiber in our diet. Okay, consuming wheat or rice is one thing. Brown rice is something which is a very high source of fiber and which people can have add to their diet. Regular amounts of fruits and vegetables are important to be included. Okay, there are some fruits which are more in fiber. Likewise, some vegetables like cucumbers
Zen.
and tomatoes, radish, all these are a good source of fiber which we can consume in our diet, and which would
Yes.
definitely increase our fiber content and help in bowel movement.
Yeah, and then also my personal experience that whenever I was concentrating a little more on adding fiber, the number of I suppose I did it a little too much, थोड़ा ज़्यादा कर दिया तो my system gave me an alert कि burps ज़्यादा हो रहे थे, bloating बहुत हो रही थी. Then I had to slow
Yes.
down. So the
Yes.
relationship is also again how you feel to certain foods.
Yes.
Each one
Yes.
is different.
Yes.
Wonderful. So, next question that I want to take up is from Lucky. Lucky is a 23-year-old MMA fighter, has abdomen pain, it moves around upper to lower, and 2 साल से इनको है, and he cannot fight because he's a fighter. He's consulted gastroenterologists from Apollo hospitals. काफी सारे medicines भी दिए हैं. 2 साल से he's been continuing, and he says he also has a lot of belching and burping as well. And by the way, he had a tightness in the chest. इतने सारे questions, इतने messages में थे, so I was reading the entire story to put up together. So he also has gone through a CT, angio, etc., and nothing's wrong with the heart. So Dr. Raghu has been treating him. Any further advice from you?
Okay. See, pain which is there for 2 years, okay, and which is not having any alarm symptoms, the first thing that I would suggest is to reassure that it's not something very serious. Okay, having pain along with the change, if there's a change in bowel movements, could mean that it is IBS, or which is known as irritable bowel syndrome. Okay, so important here is that if you have pain which is there both in upper or lower abdomen, to see what is triggering your pain. If there are specific foods that are triggering your pain, you need to avoid that. So you are a fighter means that you consume probably a higher amount of protein. Okay.
Protein.
So if you're consuming a higher amount of protein, making sure that you drink adequate amount of water also. Okay. Reducing your stress levels. Okay. Tightness in the upper abdomen, this is probably related to acid reflux. Okay, but a lot of people tend to get worried, especially post COVID, people tend to worry that, is it a cardiac related issue? And CT angio is like expected normal only. So for Lucky, I would suggest is to have a balanced meal, drink adequate water, and to not worry about it, because uh,
Stress
it's
adds
most
to it.
likely. Yes, it just adds to it. It just adds to it, and then the more you get stressed, the more the pain worsens.
Correct, correct. And maybe you should continue consulting. Having a
Yes,
regular consults, Apollo 24/7 does help you to keep your gastroenterologist as your friend, and it's pocket friendly as well. Chalo.
we are
So
always
we'll move
available
on.
for questions.
Yes, sir. Yes, sir. And we appreciate you all being here, understanding the requirement that people are not able to come forward for a physical consult. I think this is a great platform for both doctors as well as patients who want to consult.
Yes.
So let me continue with the Sai Vardhini's question. She is worried about her bowel movements and she has pain in the anal region and burning sensation as well. She's worrying if it's piles, fistula, or hemorrhoids. So what are the tests that she can take?
See, bowel movements associated with pain in the anal region could usually mean that it's a fissure. Okay. or a hemorrhoid at times. Okay, this usually is triggered by constipation, wherein a hard bowel movement tends to cause an injury in the anal canal. Okay, now this injury causes pain. Now, because of the pain, because of the reflex mechanism, what happens is that the anal sphincter gets tightened up. It goes into a spasm. Now, because of this spasm, motion cannot come out freely. So that becomes a vicious cycle. There is pain which is causing, not letting the stool come out freely. And this, if stool is not coming out freely, you would have to strain more. Now, this strain will cause more injury. So that cycle is there. That usually is seen in an anal fissure, but usually a physical examination and maybe a sigmoidoscopy wherein we put a small camera in the anal canal and we check what is going on. That is all that is needed to diagnose the condition,
Right.
and usually the treatment is given accordingly.
Right, and then people do fear all of these, and then there are so many other ways that they try and avoid a physician consult. The moment you say endoscopy or sigmoid or other processes, they tend to tighten up so much. What's your advice here? How do we
You
break
see, I
this?
feel that there is also a stigma that people associate with, these perianal conditions like fissure, fistula, piles, or hemorrhoids. Okay, and a lot of them try to consume, try to, take over the counter medications or self medicate themselves. Okay, but these are very simple. A lot of times just a clinical examination is sufficient to diagnose the condition, and all of these procedures, like you told about endoscopy or sigmoidoscopy, they are relatively simple procedures. They are office procedures. They are done in 2 minutes. And nowadays there is also the availability of sedation. So if patients who are worried about the procedure, they can just get a sedation, like get the procedure done under sedation, and they wouldn't even know what happened.
Wow.
So that's something which should not be avoided, because people present to us when they're quite severe symptoms,
Yeah.
and they've been suffering for a long time, and when treatment is available, then why should you suffer?
Do not avoid visiting a physician in case that you have a problem. Sai Vardhani, go ahead, get yourself checked. So next questions, two of these questions which are similar, I'm going to club and ask. Virendra Singh ji, 31-year-old male, digestion का problem है, energy less लगता है, he is gaining weight continuously. And Mr. Bhattacharya is, Devashish Bhattacharya is 60-year-old male, heartburn है. Diwakar is 32-year-old, स्टमक क्रैम्पिंग होता है, गैस्ट्रिक इश्यूज होते हैं, एंड लिवर, फैटी लिवर ग्रेड 2 है. So I've bunched up multiple questions here, multiple age groups as well, because there
Okay.
are a lot of questions to be addressed.
Okay, see, so देखिए, heartburn is something that people talk. Okay, so like I talked about the lower esophageal sphincter. Okay, and when there is a problem in the lower esophageal sphincter, in a small percentage of populations, the sphincter does not work properly. There is stomach acid in the stomach for each one of us, and that's something which is there and helps us in digestion. But when the lower esophageal sphincter does not perform its function well, or when it is weak, the stomach acid tends to come up into the food pipe or the esophagus, and it is not used to the acid, and that's when people experience symptoms of heartburn, which is an uncomfortable or a burning sensation in the chest. Okay, so this is a common symptom and usually reflects that these patients could be having GERD. In a young male who has symptoms of heartburn, okay, the suggestion is to avoid eating foods that are triggering the symptoms, having small meals rather than having 2 or 3 big meals, small meals 4 to 5 times in a day. Avoiding fatty foods or spicy food is very important. Those who tell that they have digestive issues, it is important to know that what is the digestive issue. A lot of people tell that they have gastric, or like they tell that we have some gastric issue or they have gas, but it is
Yeah.
what but in reality it is all, in medical terms it is called as dyspepsia, which is a constellation of symptoms which is centered around the upper abdomen. It could mean that patient has acid reflux. It could mean that the patient has acid peptic disease, gastric or duodenal ulcers. They could be having symptoms related to the gallbladder also, or pancreatic diseases. Sometimes patients with those diseases also tend to mistake their symptoms, and they tend to say that we have digestive issues, we have gas, we have bloating. So it is very varied presentation. Sometimes patients don't even know. They say that there is some discomfort, कुछ गड़बड़ लगता है पेट में. Okay. So for these patient symptoms who have digestive issues, like I talked about, maintaining a healthy diet and adequate amount of water, reducing stress and sleep is important. And for those who are telling that they have a grade 2 fatty liver, I heard that in one of, like you were talking about a patient, the person has grade 2 fatty liver. Probably a consultation with a doctor is necessary to identify what is the cause of that grade 2 fatty liver. If the patient is obese, if he has diabetes, cholesterol, other issues, because we need to tackle all those issues. But for any fatty liver, the eventual advice would be to have a healthy diet, exercise regularly, and lose weight if you're obese.
Wonderful, doctor. Thank you. That sums up the entire bunch of dyspepsia and fatty liver
Yes.
questions. So next question, that is Virendra, 54-year-old male. As soon as I eat anything, I'm burping, even after drinking water, even at passing stool. What is that a problem? That is one, because you've already addressed it. So quick answer there.
Okay, see, I talked about burping previously. Okay, so if somebody says that, if you're burping immediately after eating or drinking water, it is a normal mechanism that all of us, burp after eating a heavy meal. If you're burping immediately after eating, then you probably are eating too quickly. Okay, hurried eating, not chewing properly, drinking a lot of water is there. Okay, so the issue here would be to eat slowly, chew thoroughly. Okay, and drink water sip by sip rather than gulping down the water through a bottle quickly.
Yes, thank you, doctor. So Prasad Reddy, Varaprasad, 37-year-old male. I'm having bad breath while talking. I used to consume coffee 4 to 5 times a day due to long work hours. Does this affect my digestive system? Doctor, that's a lovely question according to me, because bad breath and digestive health is the link between both of them.
Bad breath definitely they has, or halitosis definitely has a link to the digestive system. Especially those who have digestive issues, those who have a delayed gastric emptying, they tend to have a bad breath. A bad breath, importantly, first needs, we need to exclude oral hygiene. We need to look at their dental hygiene, oral cavity, to look for if they have any dental caries and those things that need to be taken care of. uh, then important is to those is to improve your digestive system with bad breath is something which is definitely an association. Okay, so reducing your coffee intake is definitely a link, because that can cause, if you're consuming coffee, especially milk related coffee, then that tends to have acid reflux and can cause a bad breath.
Okay, okay. Thank you so much for establishing the connection between both of them. The next question is from an 18-year-old student who's from Kota. So apparently stress factor bhi hame
Yes, very
consider
high.
karna padega. Yes, so I'm glad you are asking this question. Where did I lose your question? Prasad. Yes, Ayush. Ayush is 18-year-old from Kota, facing serious constipation issue from last 2 years, and I have no other option except eating the mess food. This issue is also increasing my stress. See, basically, his stress is not just because of this. There are other factors also included in his stress.
See, we have to, understand that Ayush is in Kota. He's probably preparing for IIT or something. So he's leading a very sedentary lifestyle, maybe studying 14 to 16 hours, sitting at one place. Okay, eating only mess food, which I believe is generally a poor source of fiber. Okay, and I'm not sure what is the water intake also, because
Correct.
as students we also would sit at one place for prolonged hours, not drinking enough water, eating processed food only, because you're sitting at one place and you don't have time to go out or get something healthy. So for Ayush, I would suggest is, okay, make sure you're having some fruits and vegetables also. Fruits are easily available, right? You can just gather something that you can just chew on, maybe some apples or guavas. Making sure you drink enough water and at least some physical activity for some 20 to 30 minutes in a day. That is all that is needed for an 18-year-old to treat his constipation. I think that is
Correct.
the
And
best.
then don't let it go chronic bitter. That's what I would advise you here. And as a mother of a child who's in the hostel scenario, I understand that we are helpless here. As parents, we cannot control what the child is eating in
Yes.
the hostel. But then I would add, doctor, with your permission, that the nuts and seeds, flax seeds, chia seeds, all the trail mixes, which could be store
Yes.
bought and kept in the hostel room, which could also add to the fiber.
Definitely, definitely, they would definitely add to the fiber. Nuts and seeds, the chias or the flax seeds, definitely have a good source of fiber and would definitely help in this scenario.
Right, doctor. Thank you. And next question, moving on, is bloating. 42-year-old Rupesh Gupta has very fullness and bloating tight हो जाता है gas के साथ. So what can we help here?
See, bloating is a very varied symptom. A lot of people say that the stomach feels tight, and they feel tight that immediately after eating पेट बहुत tight हो जाता है. ऐसे लगता है कि 2 इंच कमर बढ़ गई है, शर्ट को लूज करना पड़ता है. A lot of these symptoms. Okay. In the Indian scenario, a lot of literature has suggested that a lot of people, gastroenterologists, have spoken that people who are constipated tend to think they are bloated. So
Oh,
Gupta ji, it important here is to note that whether are you constipated or not, or whether you're having an adequate bowel movement. If that is being taken care of, we have to look at why bloating is there. Okay, and here comes the role of diet. There is something or a concept known as FODMAPs, which is fermentable oligomonosaccharides and polyols. So these FODMAPs are foods. When we ingest them, they tend to increase the water content in the intestine, and they tend to increase get fermented more, producing more gas. So these symptoms, these produce the symptoms of pain, bloating, excessive gas passage, that is flatulence, and bowel disturbances. So if somebody who has bloating as a predominant symptom and his bowel movements are fine, we my suggestion is to lower their intake. Nowadays you go online, you search for FODMAPs, you get a lot of information. So avoiding food that are high in FODMAPs, high FODMAP foods includes wheat, dairy, even onions and garlics are a very high FODMAP, and consume foods which are lower in which have a low FODMAP content, and this I believe would definitely help Gupta ji with his bloating.
yeah. So food as medicine and medicine as food. I was
Choice
reminded
is
of the
yours.
Chinese proverb. As I say, गार्लिक आप लेते हो इतना तो मेडिसिन बन सकता है. गार्लिक आप स्पाइस की तरह खाते हो, फूड की तरह, तो आपको मेडिसिन लेना पड़ेगा.
जरूरत पड़ेगी. Yes.
ठीक है. So next question that I'm moving on to is Kamal Bhatia. Mucus in bowl, in the feces. So is that a thing to worry?
See, mucus is nothing but people say that they have a sticky or a gum-like s- uh, liquid which they pass in the stool, and mucus is usually seen when there is some amount of inflammation, or when in the lower intestine, large intestine, in the rectum, and that though harmless, needs to be evaluated to see if there is any intestinal infection. Okay, if there is any sort of inflammation, if it is associated with constipation, we have to treat the constipation and the mucus would eventually go. Sometimes, small perianal fistulae can also, people say that they are passing mucus in stool. But on evaluation, or when we look at it, we see that they have a perianal sinus or a perianal fistula, and that needs to be taken care of. So,
Well,
a healthy
so
bowel movement.
infection information, I did check a few H. pylori questions, which I will come forward.
Okay.
So you want them to avoid certain foods in that case, or get some tests done to understand if there is an infection or inflammation.
Yeah, I
Any
believe a stool examination, some basic blood tests like diabetes, sugar, and thyroid, and again, a sigmoidoscopy would help to see if there is any underlying or a mucosal abnormality in the large intestine, to see if so that we can address the cause rather than just treat the symptoms.
Yeah, yeah. So here is Prajwal, 35-year-old question. I have heartburn, bloating for the last 3 years. So I had an endoscopy and found a gastric erosion plus mild H. pylori infection. I consume 3 beers daily. Could this be the cause?
3 beers for the cause of H. pylori or 3 beers for the cause of the bloating and heartburn? Okay, so that is the question. The beer would not be the cause of H. pylori, but the beer would definitely be the cause of the bloating and heartburn, because 3 beers is significant alcohol intake, and would actually be on a daily basis. Okay, is amounts to significant and unhealthy pattern of drinking, and that is definitely the cause of symptoms here that I think. Okay, so cutting down on this alcohol consumption would definitely relieve you of your symptoms.
Yes. So yes, Lucky and Prasad Reddy Garu have thanked you for for your answers to their questions. Deepika Sharma is 28-year-old female, acid reflux from 6 to 7 years. I have to take antacids for a long time. Sometimes it feels like as if acid is coming into the throat, discomfort in the chest. So I understand when people are given antacids, prescription based acid. So how long do they have to take? And there are prescription misuses as well. They continue taking prescriptions as well. How to keep a watch on this?
See, as gastroenterologists, when we usually prescribe an antacid, it is for a short period of time. Usually, 6 to 12 weeks is sufficient to treat you of any mucosal, if there is any mucosal abnormality like erosions or ulcers. Okay. Beyond that, some people tend to use it longer. Okay, we've seen that patients we prescribed an antacid for a month, and but they've been taking it for years together. Okay, so if in that scenario we need to evaluate if a patient is, in spite of taking an antacid for more than 4 to 6 weeks, if they persist to have symptoms, that is an indication to get an endoscopy done to see if they have any other issue going on. Okay, if they have problem with the lower esophageal sphincter, if they have a lax lower esophageal sphincter, or if they have a hiatus hernia. Okay, and just taking antacid is not sufficient. Are you taking care of your diet? Are you eating on time? Are you sleeping on time? Are you avoiding the spicy food, the oily food, the binge eating, alcohol? All those factors need to be addressed too. Okay, taking an antacid is easy, but controlling our diet is more important, because we don't want to be dependent on an antacid tablet for the rest of our lives.
Yes, doctor. So here are questions regarding younger patients. Vijay Vail, son is 10-year-old. Constipation, cannot pass motion without enema, multiple pediatric visits, MRI abdomen, MRI deficography, blood tests, all normal, no block. Please advise.
In a 10-year-old with chronic constipation, it is good that you have consulted a gastroenterologist, because here we have to rule out if there are any underlying pathological conditions. Hirschsprung's is one disease that comes to the mind, wherein they have some problem in the nerve distribution in the lower large intestine, the lower aspect in the rectum. So if that has been ruled out by doing an anorectal manometry or an MR deficography, if you're sure that there is no a structural or a condition like Hirschsprung's has been ruled out. An important thing that I would like to highlight on this platform is that children nowadays, they don't want to use the restrooms in the school.
Absolutely.
Yes, they don't like it. They're like, we are sending them to the best of the schools, even be it, the international schools or whatever. They don't want to use the restroom in school. And because they don't want to use the restroom in the school, they're avoiding drinking water. They're there in the school. They leave at 7 in the morning or 8 in the morning, and they're coming back by 4. So in order to avoid using the restroom, drinking water, one thing. The amount of physical activity in kids nowadays has come down, and probably when we compare it to our generation, the consumption of processed food has gone up. The pizza, Maggie, and all those things has gone up. Okay, for this 10-year-old, then I would suggest is to make sure he's drinking adequate water, make sure he has adequate fiber in the diet. Prunes is something that I suggest to all my patients. Prunes are a good source of, are a good therapy that help in for these patients with bowel movement. But if he still persists to have constipation for this 10-year-old, I would suggest is to, I've not seen everything, but we have to see whether Hirschsprung's is something that has been ruled out.
Yes, I think Vijay, well, your question is well answered, and you can continue consulting Dr. Ankit. We have left his link to consult on Apollo 24/7 in the chat box as well. Rakshak's daughter is 6 year old and very less appetite. Various cuisine options were tried. This has led to marginal malnutrition for her age. Any suggestions?
See, if the child, if she's malnourished, here important to see is the child active and healthy? Okay. If she's otherwise cheerful, active, and she's been playing around and has no other symptoms like frequent vomitings, or if she's complaining of pain, or if you've noticed any blood in her stool, I would say is it's okay. Getting a basic evaluation is definitely important to look for anemia, to look for thyroid related issues, maybe get a scan done of the abdomen. But if all those have been done and all those are normal, okay, it is important to let the child be. Give her food that she's liking. But these people, if you give them food that they like, they would want to eat, the chips and the junk only. That's what kids like these days. Okay, a healthy,
Yeah.
balanced diet is important. If she still persists or complains of a loss of appetite, then probably a consult to a pediatrician or a gastroenterologist is warranted.
Right. Shruti Saraf Bansalji, can I request you to give me your age and other factors as well? Because you've placed 2 or 3 questions which I shall take up. Please do mention your age, which will help Dr. Ankit to answer your question. In the meanwhile, here's Mr. Rangarajan Raghavan's question. Colonoscopy said chronic ileocolitis with activity. There were no granuloma. Was treated with Pentasa. Then after multiple follow-up, doctor said it's IBS and not IBD. Diagnosis is not clear. What to do?
See, the the finding chronic ileocolitis and no granulomas is more of a histopathological finding. Okay, so sometimes what happens is when we do colonoscopy, we find erosions or inflammation in the lining of the intestine, and when that happens, we take biopsies. Okay, thinking it could be inflammatory bowel disease. Okay, and if it's inflammatory bowel disease, they're usually treated like here sir has been treated with pentasa, and then we recheck to see if there is mucosal healing. Okay, if the healing has occurred and if the patient is symptomatic free, probably it was IBD. But if a chronic inflammation is there, for IBS we expect the colonoscopy to be normal. We don't see erosions, we don't see chronic colitis on pathology in IBS. So if that is there, probably more evaluation is needed to see what is going on.
Well, so it's 11:42 already as I check my clock, and I have so many questions more.
I
So
didn't even realize.
yeah, I don't even haven't realized I have a lot of questions pending. Audience, please excuse me if I will not be able to take all of your questions, but we shall promise that we shall come back with Dr. Ankit and the same topic again. So, Arpan Agarwal's mother is 70-year-old, has a fishy kind of smell after waking up every morning, low diet and does not feel hungry at all. Do you suggest an ultrasound or an endoscopy to be done?
For a 70-year-old who's not feeling hungry needs to be evaluated. Okay, so at this point I would want to talk about red flag symptoms or alarm symptoms. Okay, a lot of us, when people say that, when should you consult a gastroenterologist, minor issues, gas hota hai, bloating hota hai, or some symptoms, but when should you consult a gastroenterologist at the earliest? And that's when you need to look for these red flag signs or alarm symptoms. Okay, symptoms onset after the age of 45, 50 years, new onset worsening of symptoms in somebody who's been experiencing symptoms on and off, loss of appetite, losing weight, frequent vomitings, anemia, if your hemoglobin is dropping, or if you're noticing black color stools, or if you're noticing blood in your stools. Now, these symptoms are known as red flag symptoms, and this means that something more sinister is going on. And this is when you need to consult a gastroenterologist at the earliest to rule out a more serious pathology. So for this 70-year-old auntie, I would suggest is to visit a doctor if she is losing appetite, and to get appropriately investigation, be it a scan or endoscopy. That can only be told when if she has been examined in person to look at the overall constellation of symptoms and her underlying conditions.
Wonderful. So Deepak is a 31-year-old male, high doses of probiotic capsules recently and suffering with smelly farts despite regular bowel movements daily.
Okay, so smell in our in the gas that we released, smelly farts, as people suggest, usually happens when there is a higher content of these methane producing or methane or sulfur producing bacteria in our large intestine. So these bacteria, and that is because because of this methane or sulfur is what produces the smell. So if your bowel movement is regular and if you still persist to have smelly farts, then probably we see something known as a gut dysbiosis. We have not talked about gut microbiota till now. I would like to talk a minute about
I
that.
know. Yeah,
Yeah.
please.
Okay. So
Very
our
important.
gut, yes, is loaded, or it is has a large amount of bacteria. Now, the microbiota is means that there is bacteria, viruses, and fungi. All of these together form our gut microbiome. It is varied in quality as well as quantity. The total weight of our gut microbiota is said to be over a kilo. Okay, and when this gut microbiota is disturbed, either in terms of the quality or in terms of quantity, that is known as gut dysbiosis. Now, this dysbiosis can lead to symptoms like bloating, flatulence, producing foul smelling farts, okay, and other symptoms. So these things need to be addressed. So I think sir must be having some gut dysbiosis that needs to be addressed. Probiotics are a good way to treat gut dysbiosis. Okay, so
Right.
I think we need to take care of that.
So the smelly जो भी flatulence है, it's not because of the probiotics, but maybe it's because of something else, and
Something
probiotics might
else.
help. Yeah, Deepak ji, I think you should consult one of your gastroenterologists and rule out other possibilities as well. So there is a NEET aspirant again who's trying to seek, and continuously, repeatedly, she's trying to reach out to you. Similar answer you've given, but quick answer again. 20-year-old female on laxative, 3 times fruit, Ayurveda churnas, avoiding junk, still feel constipated regularly. Please help. What I should do?
See, in these patients, young patients who have constipation, we need to rule out if there's an underlying cause. Thyroid related disorders, increased calcium hypercalcemia, diabetes. All these things need to be ruled out first. Systemic causes of constipation, like I said. Okay, if all those have been ruled out, then we look at local causes. If you know their water intake is adequate, she's telling me us that she's been taking churnas. The churnas are strong laxatives, and if they still are not helping, then there is something known as dyssynergic defecation, wherein by doing an anorectal manometry we can find out that there is a dyssynergy. Normally what happens is when we have to pass a bowel movement, our intestines have to contract and the anal sphincter has to relax. But in a major chunk of patients who have constipation and they've tried everything, they say we've tried everything but still we don't find relief, a simple test, that anorectal manometry, gives us the answer. They have dyssynergia. So when we tell them that you have to pass bowel movements, either they are not able to contract the rectum enough, or paradoxically they are increasing the anal canal sphincter pressure. So you are pressing from above, but the lower the canal has to open, but we see that they do not open the anal canal but they tighten it more. So this synergic defecation is what causes them these symptoms of intractable constipation. And usually we just give them something known as biofeedback therapy. We teach them that how to relax your anal sphincter, how to contract your rectum, and how to have a bowel movement. So it is a very simple outpatient based procedure, and that usually solves the problem for a lot of these patients. And there are few of our patients who have gone completely off laxatives with just biofeedback therapy. So this NEET aspirant, maybe after she finishes her exams, needs to visit us in person so that we can
Yes.
evaluate her and treat her accordingly.
Right. So here's Krishna Kiturju, who's a regular participant here. 75-year-old male, 75 kilos, diabetes, hypertension control में है, cholesterol भी control पे है. NAFL diagnosed 5 years back. no medication, how to reduce fatty liver and further complications. He uses Cremafin plus 2.
See, he's a diabetic, he's a hypertensive, he's 75. He's been diagnosed as NAFLD, non-alcoholic fatty liver disease, for the rest of the participants for 5 years now. Okay, so this the right now I would want to talk about NAFLD. It is the number one cause of liver disease worldwide. Okay, it has overtaken alcoholic liver disease. Okay,
Yes.
and we are seeing a lot of these non-alcoholic fatty liver disease in our day-to-day practice. So for Sir, okay, if his diabetes is in control, if his BP is in control, and if he does not have cholesterol related issues, my suggestion is to maintain a healthy diet, avoid fatty foods, regular exercise. That is all that is needed to maintain his fatty liver. If we see worsening of the grade of fatty liver, or if there is an abnormality in the liver function test, it is only then that we suggest pharmacological therapy. Otherwise, dietary and lifestyle modification is all that is needed for him to take care of the fatty liver.
Wonderful, sir. So I see a lot of questions about H. pylori, Poonam, Kalita, and a lot of them have asked H. pylori. Excessive bloating in my stomach. They have been diagnosed with and treated for H. pylori, triple therapy thrice, but still bloating and acid reflux is terrible. That's her question. And how to get rid of H. pylori is Kalita's question.
H. pylori, Helicobacter pylori, is a bacterial infection. It is something which is very common in our Indian country. Diagnosis, there are a lot of ways to diagnose H. pylori, but the common method that we use to diagnose H. pylori is by endoscopy and doing the rapid urease test, wherein a small biopsy is taken and we get the report instantaneously within 5 to 10 minutes. Okay. If somebody who has been treated for H. pylori 2 or 3 times and still continues to be positive, then the question of antibiotic resistance comes into the picture. Antibiotic resistance is a very hot topic because nowadays, because we see people consuming antibiotics, left, right, and center for even simple viral infections also. Antibiotic resistance for H. pylori is seen, and there are some areas where the resistance has gone up to even 70 to 80%. So using the same triple therapy 2 or 3 times makes no sense. And if we think that they are resistant to the triple therapy is 3 medications wherein there is 1 antacid and 2 antibiotics. Then we move on to the next second line and third line therapies, which includes quadruple therapy and other type of of H. pylori regimens, which is could be levofloxacin based regimens, bismuth based regimens, which is the quadruple therapy. So these are all different therapies available. The triple therapy is not the only therapy. So you probably need to consult your gastroenterologist if you have persisting symptoms and persisting H. pylori infection to move on to levofloxacin based therapy or quadruple therapy that might help you clear off the H. pylori infection.
I know I couldn't get time to talk about hepatitis and the vaccine, but one quick roundup because we have a minute to go. Anything that you want to add on hepatitis and the vaccine, please?
See, hepatitis, we have viral hepatitis, we have 5 viruses A, B, C, D, and E. Okay, hepatitis A and B are the vaccine preventable diseases currently. There have been trials going on for a vaccine for hepatitis E as well. Okay, hepatitis B right now is a part of the universal immunization program, but that is for children who are born over the last 5 to 10 years. For those who were born previously, the vaccine was not a part of the universal immunization program. So for those who have not got the vaccine done, it is a safe vaccine, very, very effective vaccine. They need to get the vaccination done for hepatitis B. Okay. And for those who have some underlying liver condition, this becomes all the more important to get themselves vaccinated because it prevents them from getting a serious infection. So that is
Yes.
something they need to address.
Last 1 minute for me to close. Rakshak ji, आपका question डॉक्टर साहब ने आंसर कर दिया है. Please come back after the live to check the answer. And Tapan Jyoti Biswal ji, आपका question last question होगा आज के लिए. How to tackle gluten intolerance? Please advise some probiotic or prebiotic foods for me.
See, gluten intolerance can be tackled only by avoiding gluten. Okay, so if you have,
Simple.
okay, a lot of people, they tend to come up with a self diagnosis. Now, if what is this gluten intolerance is the question here. Has it been diagnosed as celiac, or has it been diagnosed as something known as non celiac gluten sensitivity, or is it just something that people tend to tell themselves that I have gluten intolerance, but it is not something that has been diagnosed medically. So, if it is something which has been diagnosed medically, the only treatment for it is to have a
To
strict
avoid.
compliance to gluten-free diet. You need to read labels. You need to make sure that even the non-gluten flour that you're eating comes from source which is not processing gluten. Everything needs to be addressed. Prebiotics or probiotics, can help in this scenario, but gluten restriction is the only thing that will help eventually.
Right. Thank you so much, Dr. Ankit Vijay Agarwal ji. It was really very interesting to have. I know the topic is too broad today, but you
Yes,
make sure that we have many answers today.
I
So
tried
to
my best.
conclude, yeah. So to conclude, I would want you to give us top tips to keep our digestive system healthy. What are those top 5 or 10 tips that you want to share with us today?
Sure. Okay. So, my top tips for a healthy digestive system is to consume a healthy diet, drink plenty of water, include exercise in your daily routine, make sure you get adequate sleep, eat more fiber, restrict the intake of processed food and sugar, and if you have any alarm symptoms or red flag signs like loss of appetite, loss of weight, if you observe blood in your stools, if you're having vomitings, or if your hemoglobin is low, then you need to consult your gastroenterologist at the earliest, rule out a more severe problem.
Wonderful. Thank you so much, Dr. Ankit, because you were really, really very informative and patient. And a lot of questions which were left, I promise that we either have covered them or we shall cover a few more questions in the next sessions. Thank you again
Sure.
for your time on this Sunday morning.
Thank you for having me on board, madam, and thank you, Apollo 247.
Thank you, sir. Thank you. Namaskar. So that was your chance of asking questions. Now this is my chance of asking questions. I'm going to ask you 3 questions for health quiz, and you have to answer now in the chat box of YouTube only. If you're watching this on Facebook or Instagram profiles, please hop on to the YouTube channel of Apollo 24/7 where you subscribe and get a lot of other details as well. So we request you to type your answer only on YouTube chat. Here are the 3 questions, and the winners will be announced towards the end of the show. You have to write back and claim your prizes at Apollo while you write back to us at marketing@apollo247.com. The 3 questions for today are: fill in the blanks. Regular exercise helps food move through your. Oh, I'm sorry, I did the blank and quickly. If you have reading, regular blank E से शुरू होता है, helps move the food through your digestive system faster. Question number 2 is true or false? Lack of sleep does not affect the digestive system. True or false? Question number 3, yes or no? Diet and other lifestyle choices greatly impact your digestive health. Yes or no? I repeat the questions, fill in the blanks. Regular blank helps the food move through your digestive system faster. E से शुरू होता है, E से end होता है. What is that? Question number 2, true or false? Lack of sleep does not affect the digestive system. Question number 3, diet and lifestyle choices greatly impact your digestive health, yes or no? These are the 3 questions. Keep your answers coming, and here are the coupons you can use on Apollo 24/7. The first one is code AskDoc150, ASKDOC150. Consult top doctors from Apollo Hospital directly, and 150 rupees cash पा सकते हो when you consult doctor online. And next one is first 3, FIRST3, order medicines direct from Apollo, get 25% off on online medicine orders as well, and you get 2-hour delivery if you order from Apollo 24/7. The next one is exclusively for our Health Hub viewers. Use the code HH247 to get 199 off on online doctor consultation with Apollo doctors and up to 20% off on medicine orders. This is in addition to the other 2 coupons which we have given and exclusively for our Health Hub viewers. And also let me remind you that Apollo 24/7 is also just a call away or a text away. You can call or text on WhatsApp 09355247247. This is the number you got to save to avail healthcare services. So while I see a lot of people are answering. Yes, oh, our regulars also have returned back. Let's see who the winners are. By the way, next week we are going to talk about backache. Kamar dard kaise dur kare? This is our topic, 3rd March, 11 a.m. We are waiting for your answers to come. But in the meanwhile, if you are suffering from backache, any sort of issues with your spine, do join us on 3rd March, 11 a.m., where we can get you some kind of relief. We can see what your problems are. So, the winners for this week are Tapanjyoti Biswal, Anmol Ratan Singh, and Vamsi Nallamalli. Congratulations. You have to write back to us before Wednesday with all your contact details, name, number, etc. to marketing@apollo247.com, and gift vouchers will be shared with you. You have all your names and other details in the chat as well. Chaliye, thank you so much all of you for joining us this Sunday. फिर मिलते हैं next Sunday. Namaskar.